In the world of medicine, the operating room is a sanctuary, a place of precision, trust, and the promise of healing. Patients place their lives in the hands of surgeons, believing in their years of training, their steady hands, and their oath to do no harm. But what happens when that trust is broken? What if the person holding the scalpel is not a healer but a predator? In Dallas, Texas, a charismatic neurosurgeon named Christopher Duntsch promised miracles, but a terrifying pattern began to emerge. Patients went in for routine surgeries and came out paralyzed, maimed, or worse. The question was no longer if he was hurting people, but why was no one stopping him? Dr. Christopher Duntsch arrived in Dallas with a glittering resume, an MD and a PhD from a prestigious university program. He was confident, charming, and convincing. His first patient in Dallas, Kenneth Fennell, needed a simple spinal fusion. Duntsch operated. When Fennell woke up, he couldn't move his legs. Another patient, Floella Brown, went in for a cervical fusion. Duntsch sliced a vertebral artery. She had a massive stroke on the operating table and later died. Kelly Martin went in for a minor back pain procedure. She bled to death after Duntsch severed a major blood vessel. His best friend, Jerry Summers, allowed Duntsch to operate on him. He woke up a quadriplegic, unable to move from the neck down. The pattern was undeniable. In less than 2 years, Duntsch had operated on 37 patients in the Dallas area. 33 were left with serious, permanent injuries. 2 were dead. He was not just making mistakes, he was butchering people. And somehow he kept getting away with it. The first to sound the alarm were 2 fellow surgeons, Dr. Robert Henderson and Dr. Randall Kirby. Both were respected veterans in their field. Dr. Henderson was called in to perform a salvage surgery on one of Duntsch's patients. What he found horrified him. Hardware was misplaced, bone was removed for no reason, and a nerve root had been amputated. It was, he later said, as if Duntsch had no idea what he was doing. Dr. Kirby had assisted Duntsch in a surgery and was so appalled by his incompetence and recklessness that he physically intervened to stop him. Kirby described Duntsch's technique as that of a child playing with tinker toys. He knew immediately this man was a clear and present danger to the public. Together, Henderson and Kirby began a relentless campaign. They wrote letters, made phone calls, and alerted the Texas Medical Board. They were convinced that once the authorities saw the evidence, Duntsch's medical license would be revoked immediately. They were wrong. The question everyone asks is, how could this happen? The answer lies in the deep systemic flaws of the American healthcare system. When a hospital has a problem doctor, their primary concern is often not patient safety but legal liability. Firing a doctor can lead to a wrongful termination lawsuit, so instead they often allow the doctor to quietly resign. They write neutral letters of recommendation, a practice known as passing the trash. Duntsch was passed from one hospital to the next. Each time, his disastrous record was effectively hidden from his new employer. Furthermore, the National Practitioner Databank, a confidential database designed to track malpractice, is not available to the public. Patients have no way of knowing a doctor's true history. The Texas Medical Board, the very body designed to protect the public, was slow to act. Burdened by bureaucracy and a high standard of proof, their investigation dragged on for months. While they investigated, Christopher Duntsch was still practicing. He was still seeing patients, and he was still harming them. As the medical board moved at a glacial pace, Henderson and Kirby realized they had to escalate. They contacted the Dallas County District Attorney's Office. They brought their mountain of evidence to a young, ambitious prosecutor named Michelle Schuhart. At first, she was skeptical. Doctors get sued for malpractice. They don't get charged with crimes. But as she dug into the case files, her skepticism turned to horror. She saw the pattern, the maimed patients, the deaths, the inexplicable surgical errors. They found evidence of Duntsch operating after using cocaine. They found records of him drinking heavily the night before complex surgeries. The most damning evidence, however, came from Duntsch himself. Investigators uncovered a long, rambling email Duntsch had sent to his girlfriend and office manager just a few years earlier. In it, he laid out his twisted philosophy. He compared himself to God, Einstein, and the Antichrist. And then the chilling sentence that would become the cornerstone of the prosecution's case: "I am ready to leave the love and kindness and goodness and patience. I am ready to become a stone-cold killer." This was the twist. The prosecution's argument was no longer about simple incompetence or medical malpractice. This was about intent. They argued that Christopher Duntsch knew exactly what he was doing. He was intentionally maiming his patients. In July 2015, Christopher Duntsch was arrested. The charge was unprecedented: injury to an elderly person, a first-degree felony. They chose one of his most egregious cases, Mary Efford, whom he had left in a wheelchair. The trial was a media sensation. One by one, Duntsch's victims took the stand, telling their stories of pain, betrayal, and loss. Dr. Henderson and Dr. Kirby testified as expert witnesses, explaining to the jury in clear, horrifying detail the sheer depravity of Duntsch's surgeries. The jury deliberated for only 4 hours. The verdict was guilty. Christopher Duntsch was sentenced to life in prison. It was a landmark case, the first time a doctor was convicted of a crime for their actions in the operating room. For his victims, it was a measure of justice, but the scars, both physical and emotional, remain. The story of Dr. Death is a chilling reminder that the systems designed to protect us can fail. It's a testament to the courage of whistleblowers and a powerful warning about the dangers of unchecked power in any profession. The most important lesson from this tragedy is the power of advocacy. Being an active participant in your own healthcare is not optional, it's essential. Always research your doctors. Check your state's medical board website for any disciplinary actions. Don't be afraid to ask for a second or even a third opinion. Trust your instincts. If a doctor seems too arrogant, dismissive of your concerns, or promises results that sound too good to be true, walk away. Your health is your most valuable asset. Protect it with vigilance, knowledge, and courage.